Hey everyone, today I'll be talking about anatomy of rectum in brief. Rectum is the distal portion of the large gut in the posterior pelvis, which is placed between the sigmoid colon above and the anal canal below, in front of sacrum and coccyx. The upper third of rectum is covered by peritoneum on front and sides. Anteriorly, it is related to the intraperitoneal structures, and posteriorly, it is related to the sacrum. Middle third of rectum is covered by peritoneum in the front. In males, it is related to the urinary bladder and the denonvillous fascia in the front and to the Welder's fascia behind. In females, it is related to the cervix and the vagina in front. Lower third of the rectum is infraperitoneal. It is related to the prostate and the seminal vesicles in front and behind to the pelvic floor in males. In females, it is related behind to the vagina. Some important points on rectum. Rectum is pulled forward by the puborectalis muscle, forming the anorectal sling, which is primarily responsible for the rectal continence. Hostrations appendices epiploicae and taeniae are absent in rectum. Rectum has got 3 lateral flexions, which are the left, the right, and the left from below upwards. Just a few points on rectosigmoid junction. The rectosigmoid junction is 15 centimeters from the anal verge. It is the segment of bowel comprising last 7 centimeters of the sigmoid colon and upper 5 centimeters of the rectum. Supports of rectum include the pelvic floor and the muscles, the fascia of Welder, which is condensation of the pelvic fascia behind the rectum, and it contains the superior rectal vessels and the lymphatics. The lateral ligaments of the rectum, which are condensation of the pelvic fascia and attaches rectum to the posterolateral wall of the lesser pelvis. The denonvillous fascia, which is facial condensation which separates rectum from prostate in males, and the perineal body, which is present in front of the anorectum. Blood supply of rectum is as follows. Arterial supply include the superior rectal artery, which is a branch of the inferior mesenteric artery, middle and inferior rectal arteries, which are branch of the internal iliac artery. And the median sacral artery from the abdominal aorta. Venous drainage of rectum is as follows. The submucosal rectal venous plexus surrounds the rectum. It communicates with the vesical plexus in males and communicates with the uterovaginal plexus in females. The internal plexus joins the superior rectal veins. The upper one of external plexus joins the superior rectal vein. The middle one of external plexus joins the middle rectal vein, and the lower one of the external plexus joins the inferior rectal vein. The superior rectal vein drains the inferior mesenteric vein. The middle rectal vein drains to the anterior division of the internal iliac vein. And the inferior rectal vein drains the internal pudendal vein. The sympathetic nerve supply of rectum is from the L1 and L2 segments and includes the inferior hypogastric plexus. The parasympathetic nerve supply of rectum is through the S2, S3 and S4 segments and include the pelvic splanchnic nerve. Lymphatic drainage of rectum is as follows. The upper half of the rectum drains into the inferior mesenteric nodes, and the lower half of the rectum drains into the internal iliac and sacral nodes. So this was all about anatomy of rectum in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video and subscribe to my channel. Also, you can check out my YouTube video on anatomy of colon in brief, the link for which has been mentioned in the description below. Thank you.